All right, let's dive into a topic that people kind of whisper about, but they don't really like to talk about openly.
Mm-hmm.
Penile size. It's a subject that's shrouded in myth and anxiety,
Yeah,
and frankly, a lot of misinformation.
you're absolutely right.
Eh,
It's fascinating how much baggage we carry around this topic.
Exactly, and that's why we're tackling it head on today,
Yeah,
using the European Association of Urology guidelines
quite.
on sexual and reproductive health as our guide.
Mm.
We want to help you separate fact from fiction,
Right.
navigate these often misunderstood waters.
What's really interesting is how much history plays a role.
Mm.
Think about all those phallic symbols throughout time.
Oh, yeah.
From ancient sculptures to
Well,
even, unfortunately, contemporary media like the porn industry.
yeah.
They all contribute to this idea that bigger is always better.
Oh, for sure.
You know?
It makes you wonder how much of our anxiety around penis size
Yeah.
stems from these cultural influences rather than, actual reality.
That's a great question. And the data actually paints a pretty clear picture.
Yeah.
A surprising 84% of women
Wow.
report being satisfied with their partner's penis size.
84%, that's a huge majority.
It is.
So where's the disconnect coming from?
Well, men's self-reported satisfaction is significantly lower, only around 55%.
Okay.
And there's even research suggesting that men who crave social approval
Mm-hmm.
tend to overestimate their size.
Wow.
It's a fascinating look into how self-perception can be skewed.
Really makes you think, doesn't it?
It does.
But even beyond those perceptions, isn't there also this idea that a bigger size automatically equals a better sexual experience?
While size can be a factor, it's definitely not the be-all and end-all.
Okay.
One study found that reducing penetration depth
Mm-hmm.
actually led to a noticeable decrease in pleasure for both partners.
Okay.
So it's more nuanced than simply equating size with satisfaction.
So if size isn't the only thing that matters, how do we even define what's normal when it comes to penile size?
Right.
Is there a magic number?
You'd think so, right?
Yeah. Yeah.
But there really isn't a universally accepted definition of normal.
Okay.
The EAU guidelines we're looking at use something called stretched penile length, or SPL, as a key measurement.
So how does that work? Do you just grab a ruler and...
Haha, not quite.
Okay.
It's measured from the pubic bone to the tip of the penis
Mm-hmm.
while it's stretched. But even this method can have variations,
Uh-huh.
which highlights the fact that there's a degree of inconsistency
Okay.
even in how we measure.
So if there's no standard definition of normal,
Right.
how do doctors determine if someone has a short penis?
The EAU uses the term micropenis for cases that fall 2.5 standard deviations below the average length
Wow.
for a man's age and race.
Okay.
But beyond that specific diagnosis, a short penis can be caused by several different factors.
Okay, so let's break that down.
Okay.
What are some of those different causes?
One category is called false penile shortness,
Okay.
which is essentially a buried penis.
Okay.
It's like the penis is normal in size,
Mm-hmm.
but hidden beneath excess skin or fat.
A buried penis. That
How-
sounds uncomfortable.
It can be.
Yeah.
And it's not just a cosmetic issue.
Right.
It can lead to real problems
Oh, wow.
with hygiene and even erectile dysfunction.
So how does a buried penis happen?
It can be congenital,
Okay.
meaning present at birth,
Right.
or acquired later in life.
Gotcha.
Obesity is a major risk factor for the acquired version.
Okay.
But things like aggressive circumcision or certain skin conditions can also contribute.
Wow, I never knew that.
Yeah.
So what about cases where it's not a buried penis,
Right.
but the penis is actually anatomically smaller?
Yeah.
What causes that?
We call that intrinsic penile shortness.
Oh.
And like the buried penis, it can also be present from birth or acquired later in life.
What are some of the causes in those cases?
If it's congenital,
Okay.
meaning present from birth,
Right.
it could be due to hormonal issues
Yeah.
or genetic syndromes.
Okay.
If it's acquired,
Mm.
meaning it develops later in life,
Right.
it could be caused by things like Peyronie's disease,
Mm-hmm.
where scar tissue forms in a penis,
Okay.
or even as a side effect of certain surgeries.
So there's a lot more to this than meets the eye, so to speak.
There is.
But before we get into the treatment options,
Right.
isn't there also a psychological component to all of this?
Absolutely. Some men experience something called body dysmorphic disorder, or BDD,
Mm.
where they fixate on a perceived flaw,
Yeah.
in this case, their penis size,
Right.
even if it falls within a normal range.
So it's not always about the actual size,
Hmm.
but the perception of size.
Exactly. And this is crucial to understand.
Right.
Because for men with BDD,
Yeah.
physical interventions like surgery
Okay.
might not address the underlying psychological distress.
That makes a lot of sense. So before we jump into treatments, it sounds like the first step is figuring out what's actually causing the concern,
Exactly.
both physically and mentally.
You hit the nail on the head.
Okay.
A thorough evaluation is key.
Okay, so let's say someone has been evaluated and they are looking for treatment options.
Yeah.
What are some of the possibilities?
Well, as you might expect, the right approach depends entirely
Mm-hmm.
on the underlying cause and the individual's goals.
Let's start with non-surgical options.
Okay?
What can be done without going under the knife?
As we just discussed, therapy is crucial
Mm-hmm.
for addressing BDD or anxiety related to penis size.
Right.
Then there's penile traction therapy, or PTT,
Okay.
which uses a device to gently stretch the penis over time.
Hold on. You can actually stretch your penisness.
You can.
Does that actually work, I mean?
It might sound surprising,
Yeah.
but there's evidence that PTT can be effective.
Okay.
Studies have shown that consistent use can lead to average length gains
Okay.
of about 1 to 2 centimeters.
Interesting.
Yeah.
So it's not a magic bullet. But it could make a difference for some men.
It could.
What about those vacuum pumps you hear about? Do those work for length?
Unfortunately, the evidence for vacuum pumps as a length enhancement tool is pretty weak.
Okay.
They're more commonly used for post-prostatectomy recovery.
Okay, so we've got therapy, traction devices,
Right.
and a limited use of vacuum pumps.
Mm-hmm.
What about hormone therapy? Is that an option for adults?
Hormone therapies like testosterone or DHT
Right.
can be helpful for boys with micropenis during puberty,
Okay.
but they're not effective for increasing penis size in adult men.
So that covers some of the non-surgical approaches.
Right.
What about surgical options?
Okay.
Where do we even begin with that?
The surgical options are incredibly varied,
Okay.
and they really depend on the specific issue at hand.
Okay.
Let's start with acquired buried penis.
Okay.
The goal of surgery in these cases is to restore normal anatomy and function.
So it's not just about aesthetics.
Right.
It's about improving functionality and overall well-being.
Precisely. And they highlight various surgical techniques,
Okay.
from simply unburying the penis
Mm-hmm.
to more complex procedures like that schienectomy we discussed,
Right.
which removes excess fat in the pubic area.
But they also emphasize the importance of lifestyle changes, right? Particularly weight loss
Absolutely.
to improve outcomes.
Losing weight can make a huge difference
Okay.
in the severity of ABP and increase the chances of a successful surgical outcome.
So it's not just about going under the knife. It's about taking a holistic approach
Exactly.
to health and well-being.
Exactly.
That makes sense. Now, what about cases where the penis is anatomically small from birth?
Yeah.
Those intrinsic shortness cases we talked about earlier.
Yes.
What are the surgical options there?
Those cases can be a bit more complex,
Okay.
and the surgical approaches are really diverse.
Right.
We can think about them in a couple of categories.
Okay.
Some procedures aim to increase the amount of penile shaft that's exposed.
So it's like you're making more of what's already there visible.
Exactly.
Yeah.
One example is suspensory ligament release,
Okay.
where the ligament that attaches the penis to the pubic bone is detached.
Mm-hmm.
This can allow for more of the shaft to be exposed,
Okay.
potentially increasing length.
How much length are we talking about with a procedure like that?
Studies have shown average increases of about 1 to 2 centimeters,
Okay.
but the results can vary depending on the individual.
Right. Right.
Then there are procedures that change the appearance
Mm-hmm.
by repositioning the angle between the penis and the scrotum,
Okay.
or by removing excess fat in the pubic area.
So some procedures are about repositioning,
Right.
and others are about removing excess tissue to change the appearance.
Exactly.
Are there any surgical options that actually change the structure of the penis itself?
Yes, there are,
Okay.
and those tend to be reserved for the most severe cases.
What are those more complex procedures like?
One example is total phallic reconstruction, or TPR. This is a very involved procedure where a new phallus is created,
Mm-hmm.
often using tissue grafts from other parts of the body.
Oh, wow.
It's typically reserved for cases of micropenis or traumatic penile loss.
Wow, that's incredibly complex.
It is.
I can only imagine how challenging that must be, both for the surgeons and the patients.
It is a very serious procedure, and it highlights how diverse the surgical landscape is
Yeah.
when it comes to addressing penile size concerns.
This is all so fascinating.
It is.
We've covered a lot of ground already.
We have.
from historical perceptions
Yeah.
to the various causes of a short penis, and even a glimpse into some of the treatment options.
And we've just scratched the surface.
Exactly. But before we get ahead of ourselves, we'll be back with part 2, where we'll dive deeper into the EAU's specific recommendations on different treatment options
Okay.
and explore some of the factors that go into making this decision.
Sounds good.
Stay tuned.
All right.
Welcome back. I don't know about you, but my mind is officially blown. We've just scratched the surface of penile size, and it's clear that there's so much more to this topic
Absolutely.
than those simplistic myths and anxieties we often hear about.
And remember, we're using the European Association of Urology guidelines as a roadmap for this deep dive.
Right.
They offer a wealth of information based on the latest research.
Right. So let's dig back into those guidelines.
Okay.
In the first part, we talked about how important a thorough evaluation is.
Yeah.
It's not just about measuring length or girth.
Right.
It's about understanding the whole picture.
Exactly. The EAU guidelines really emphasize that individualized approach.
Okay.
They recommend a detailed medical history, looking at things like Peyronie's disease, any history of trauma, previous surgeries, all of those pieces of the puzzle.
And of course, we can't forget the psychological assessment, right?
Absolutely.
Making sure body dysmorphic disorder or other mental health concerns aren't driving those anxieties.
It's about treating the whole person, not just the physical symptoms.
It seems like the EAU is really advocating for a holistic approach.
They are. And another key point they stress is the importance of realistic expectations.
Yeah.
Both for the patients and their partners.
Right, because there's so much misinformation out there about what these treatments can actually achieve.
Exactly.
Yeah.
And it's crucial for men to understand both the potential benefits and the risks before making any decisions.
And to remember that size isn't everything when it comes to a satisfying sexual experience.
Couldn't agree more. A fulfilling sexual experience goes way beyond just the physical.
Right.
It's about communication, intimacy, that emotional connection.
Okay, so let's get into some specifics.
Right.
What do the EAU guidelines actually say about the different treatment options?
Okay.
Starting with those non-surgical approaches.
Well, they acknowledge that penile traction therapy,
Okay.
that PTT we talked about,
Yeah.
can be a viable option for increasing length.
Mm-hmm.
But they're also careful to point out that the results can vary. They cite studies showing average gains of 1 to 2 centimeters.
Yeah.
But it's not a guarantee for everyone.
Right. It's important to remember that there's no magic bullet here.
Exactly. And when it comes to those vacuum pumps,
Yeah.
the guidelines specifically recommend against using them for length enhancement
Oh.
because the evidence supporting their effectiveness is pretty weak.
Okay, so traction therapy might be worth considering for some men,
Right.
but steer clear of those vacuum pumps for length.
Right.
What about surgical interventions?
Okay.
Specifically for those with acquired buried penis.
For acquired buried penis, or AABP,
Right?
the guidelines generally recommend surgery to restore that normal anatomy and improve quality of life.
So it's not just about aesthetics.
Right.
It's about improving functionality and overall well-being.
Precisely. And they highlight various surgical techniques,
Okay.
from simply unburying the penis to more complex procedures like that escutcheonectomy we discussed,
Right.
which removes excess fat in the pubic area.
But they also emphasize the importance of lifestyle changes, right?
Absolutely.
Particularly weight loss to improve outcomes.
Losing weight can make a huge difference in the severity of ABP and increase the chances of a successful surgical outcome.
So it's not just about going under the knife.
Yeah.
It's about taking a holistic approach to health and well-being.
Exactly.
That makes sense. Now, when it comes to cases of congenital intrinsic shortness,
Okay.
meaning the penis is anatomically smaller from birth,
Right.
the EAU guidelines actually suggest starting with those less invasive procedures we discussed, like suspensory ligament release or those procedures that reposition the angle of the penis.
Exactly. Those are often the first line of treatment.
Okay.
And if those options aren't sufficient,
Yeah.
then more complex procedures like total phallic reconstruction might be considered down the line.
But again, the guidelines really stress weighing those potential benefits and risks carefully
Yeah,
before opting for any type of surgery.
absolutely. It's a major decision that shouldn't be taken lightly.
Now, I know we briefly touched on girth enhancement in the first part.
All right.
What do the EAU guidelines have to say about that?
Girth enhancement is definitely gaining popularity.
Okay.
But the guidelines point out that there's a lack of consensus when it comes to these procedures.
So it's more of a gray area compared to length enhancement?
In some ways, yes.
Okay.
They recommend hyaluronic acid injections as a relatively safe and effective option for increasing girth, but they strongly advise against using those unapproved substances like silicone or paraffin.
Right. We talked about how those unapproved substances can lead to serious complications down the line.
Exactly. The risks are just too high.
Yeah.
The guidelines also mention using autologous fat injections for girth enhancement.
Which is where they take fat from another part of the body and inject it into the penis, right?
That's right.
Yeah.
But even with this technique,
Yeah.
they caution that long-term data is still limited, and they consider other techniques like grafting procedures and biodegradable scaffolds to be experimental.
So the takeaway here is that while girth enhancement is an option, it's important to proceed with caution and consult with a qualified professional who can guide you through those potential risks and benefits.
I think that's a great summary. It's an area where ongoing research is really important.
Okay, so we've covered a lot of ground here in part 2.
Yeah.
Breaking down those EAU guidelines and looking at the different approaches to addressing penile size concerns.
Right.
What are some of the key takeaways you'd like our listeners to remember?
I think one of the biggest takeaways is that there's a wide range of options available.
Yeah.
But a thorough evaluation is essential to figure out the underlying cause and determine the best course of treatment.
Right.
It's not a one-size-fits-all situation.
And to reiterate, that size is just one aspect of a fulfilling sexual experience.
Absolutely. Open communication with your partner. Addressing any anxieties or insecurities and focusing on pleasure and intimacy can go a long way.
The guidelines also emphasize the importance of seeking care from qualified and experienced professionals who can provide personalized guidance and support.
That's crucial. This is a sensitive topic.
Right.
And it's important to feel comfortable and confident in the care you receive.
And to always prioritize safety and well-being over those unrealistic expectations that we talked about.
Couldn't agree more. It's about making informed decisions that align with your individual needs and goals.
We've covered a lot of ground, but there's still more to explore. We'll be right back for the final part of our deep dive into penile size, where we'll take a step back and consider the bigger picture implications of what we've learned. Stay tuned. And we're back for the final part of our deep dive into penile size.
It's been quite a journey, hasn't it?
It has.
From those ancient phallic symbols to modern-day anxieties and cutting-edge surgical techniques.
It's amazing how much we've uncovered.
It really highlights how much we don't talk openly about these things.
And that's what the deep dive is all about, right? Shining a light on those taboo subjects and giving our listeners the knowledge to form their own informed opinions.
Precisely. And as we wrap up our exploration, I think it's crucial to step back and look at the bigger picture.
Okay, I'm ready for those big picture insights.
This deep dive has really underscored the intense pressure men face when it comes to their bodies. Particularly in a society that often bombards us with these idealized and, frankly, unrealistic images of masculinity.
You're right. The media, and especially the pornography industry, can really distort our perception of what's considered normal or desirable when it comes to penis size.
And those distorted perceptions can have a real impact.
Absolutely. They can fuel anxieties, insecurities, and even lead to risky behaviors or those unnecessary medical interventions we talked about.
Exactly. So how do we combat these harmful societal pressures?
Right.
How do we create a healthier, more accepting view of male bodies?
That's the million-dollar question, isn't it?
It is. And I think it starts with education and open, honest dialogue.
Like what we're doing right now.
Exactly. The more we talk about these issues frankly and factually, the less power those unrealistic images and expectations have.
We need to challenge those narrow definitions of masculinity and promote a more diverse and accepting understanding of what normal really means.
Couldn't agree more. And encourage men to focus on their overall health and well-being rather than getting fixated on one specific body part.
I love that. True confidence comes from feeling good about yourself.
Yes.
Physically, mentally.
Right. Absolutely. And for those men who are struggling with anxieties related to penis size, seeking professional help is so important.
Right.
Therapists specializing in body image issues can be incredibly valuable.
They can provide support, guidance, and help men develop those coping mechanisms to challenge those negative thoughts and cultivate a more positive relationship with their bodies.
It's about empowerment.
Right.
And taking control of your own narrative.
Well said. So as we bring this deep dive to a close, What's that final thought-provoking question you'd like to leave our listeners with?
Given all the complexities and potential risks we've discussed,
Yeah.
where do we draw the line between acceptance and self-improvement? Is pursuing physical modifications a valid expression of individual autonomy? Or should we focus on embracing our bodies as they are?
Right.
It's a question that deserves careful consideration.
That's a brilliant question, and one that I hope everyone listening will take some time to reflect on.
Yeah.
There's no easy answer.
Right.
The decision of whether or not to pursue any type of body modification is deeply personal, but it's crucial to make that decision from a place of knowledge, self-awareness, and a healthy dose of self-acceptance. Thank you for joining us on this fascinating exploration of penile size.
It's been a pleasure.
We hope you've gained some valuable insights and maybe even challenged some of your own assumptions. Remember, knowledge is power. And the Deep Dive is always here to help you navigate the complexities of life. Until next time.